Hello everyone, and welcome to this presentation about the Student Wellbeing Action Group, or SWAG, developed for UNSW medicine students. My name is Gary Velan. I'm the Senior Vice Dean Education for UNSW Medicine and Health, and I'll be joined today by Josh Lowinger, who is the President of the UNSW Medical Student Society. So you might be asking yourself, what is SWAG? I would like to say that it's this type, but of course, I don't have that type of swag. The swag that we're talking about today is a partnership between faculty of UNSW Medicine and Health and our medical students to improve their mental health and well-being. Why are we doing this? There have been numerous reports in the literature of poor mental health among medical students. A systematic review and meta-analysis published in JAMA in 2016 reviewed the incidence of poor mental health among medical students worldwide. They found that over a quarter of medical students suffer from depression or depressive symptoms at any one time, compared with the population average prevalence of 8%. So we have a major problem for medical students. On top of that, only 1 in 7 medical students with depressive symptoms seeks help, compared with 1 in 3 of the general population. There is therefore a real cause for action here. And in 2018, we set up a SWAG to do something about this. I'll now hand you over to Josh Lowinger to talk about how we did it.
Thanks so much, Gary, and hi, everyone. So in terms of how the SWAG functions, it is a partnership between faculty and students that provides a platform for students and staff to discuss, implement, and evaluate initiatives, events, policies, and strategies to bolster students' mental health and well-being. So it becomes a group where we can discuss these strategies and then actively action them. It, as I mentioned, is a partnership, and it is co-chaired by a student and a faculty member. So in this case, myself as the president of the Medical Society and Gary as the Senior Vice Dean of Education. So it's really a top-down approach to mental health. And its membership includes key faculty staff and students from a diverse array of backgrounds. So among our students, when we do a call out, we ensure that we have students from Indigenous backgrounds and non-Indigenous backgrounds, that we have LGBTQI+ representation, that we have international students, rural students, students of all genders, and we also have our designated student wellbeing officers. From a faculty perspective as well, we also have our dedicated faculty wellbeing officer, our equity, diversity, and inclusivity faculty officer, our rural faculty officer as well. Now, within the SWAG, we have 4 working groups, which is essentially where the bulk of the discussion occurs. So the first of these is our Enhancing Wellbeing group. And this is really looking at wellbeing holistically, looking at how we can be proactive in ensuring that all students of all years have the strategies they need to best look after their own and their patients' and colleagues' wellbeing. We then have our Building Communities subgroup, which is looking at how fundamentally to ensure well-being, we want our students to feel part of a community, to feel that they are socially connected, that they are professionally connected with their peers and their faculty. The third one is our Successful Transitions Working Group, which looks at all of those difficult transitions. So the transition into medicine, the transition into the clinical environment and between different years. Also the transition for international students coming into Australia or students perhaps going rurally, ensuring that all of those transitions are well supported. And finally, supporting students with mental health challenges. As Gary mentioned, there is that very high prevalence. So it's looking at how we can best support those students when those challenges arise. So to quickly discuss some of the key successes of each working group, so that hopefully you yourselves can perhaps action some of these or take these on board. So one great initiative was the development of flexible self-care days for all medicine students across all years. So essentially, if students have a need to take time off, to look after themselves, or perhaps to take care of their mental health or for care responsibilities, they can log these online without having to give a reason. for a number of days per term. We also had a revamp of sexual assault and domestic and family violence curriculum, since this is such an important area. And we've also had revamps of our queer curriculum, disability curriculum as well. There was a project to eliminate bullying, harassment, and sexual misconduct, and also development of some reporting guidelines so that students facing bullying or harassment can easily report these. And finally, the development of a mental health and wellbeing guide for students. Within our Building Communities working group, the development of student and faculty events, both academic and social, to connect all aspects of the community. There was an enhancement of in-person facilities and common spaces to allow that building of friendships and camaraderie. Mental health support at our rural campuses in particular, where it might otherwise be more difficult to access those supports. Extensive mentoring programs, including a hospital buddy system connecting students from first year right through to sixth year. The development of peer-assisted student support, which are sessions where senior medical students will mentor and tutor first and second year medical students. The creation of medicine college culture for both sporting and academic events. And finally, avenues for online community, which was so important over the COVID pandemic. In our successful transitions group, looking in particular at supporting the rural campuses, and as mentioned, and our international students with support groups and mental health support. We also developed an ESL mentoring program for students with English as a second language, where students who are English speakers as their first language can help them with assignments and projects. Regular student faculty Q&A and webinars, where students' questions can be answered. And finally, student written guides for every single phase of the program to make that transition nice and easy. And finally, in our supporting students with mental health challenges working group, ensuring that our faculty wellbeing officer is well known and can support students as much as possible. The provision of mental health first aid courses for all students. Absence guidelines to ensure that students know when they can take time off. And finally, ensuring that flexibility is allowed when part-time learning is required. So some limitations and recommendations that we would suggest now that we're in the fourth year of the student wellbeing action groups. Firstly, ensuring that there is real progress made, there is real action taken and goals are set rather than just consisting of updates. The importance of the working group meetings, as this is where the real action and discussion occurs. Ensuring that membership is representative and that there are a good amount of voices, but not too many that voices can't be heard. And finally, preventing burnout, ensuring that there is a rotation of members after the 2-year period. I'll now pass back to Gary with some final points.
Thanks very much, Josh. So how do we progress with SWAG? Where is the next step? So already within the Faculty of Medicine and Health, we've extended SWAGs to include our other health professional programs, and the university is now looking into extending the presence of SWAGs in other programs across the university. Within medicine and health, our health professional program SWAGs are collaborating with each other to learn of each other's initiatives and to spread good practice, as well as supporting each other to provide the best possible outcomes for our students. That's the end of our presentation. We'd be very happy to get back to you if you have any questions or comments. And I would encourage you all to consider whether student wellbeing action groups are right for your particular context. Thank you for your attention today.